My presentation is on bone cancer, and my name is Brian Ronick. In this presentation on bone cancer, the following areas will be covered: definition and key terms, bone cancer in our health, misinformation, types of bone cancer, causes, symptoms, diagnosis, and treatment. Primary bone cancer is when you have malignant or cancerous tumors that develop in the bone tissue. Almost all types of cancer can spread to the bone. Breast and prostate cancer are the two that are most likely to spread. Once cancer has spread to the bones, there is a very small chance that it can be cured. There are two types of bone tumors, malignant and benign. A malignant tumor of the bone is cancerous and will destroy normal bone tissue. A benign bone tumor is non-cancerous, it will not spread, destroy bone tissue, and are unlikely to be a threat to life. Of the two tumors, benign are more common than malignant ones. Primary bone cancer is extremely rare and only accounts for less than 1% of all cancers. There are about 2,300 new cases of bone cancer per year. The 5-year survival rate of primary bone cancer is around 70%. Many people think that when cancer metastasizes or spreads to the bone from other areas that it is considered to be bone cancer. However, that is not true. Instead, the cancer is named from where it originated from, and so prostate cancer that spreads to the bone is called metastatic prostate cancer, not bone cancer. Osteosarcoma is the most common type of bone cancer, and it starts in the area where new bone tissue is made. These tumors are likely to be found in the knee and upper arm. Chondrosarcoma begins in the cartilage that are located at the end of the bone. It occurs most often in the pelvis, upper leg, and shoulder. Ewing tumors can be found in both bone and soft tissue. ESFTs are most commonly found in the backbone, pelvis, leg, and arms. Bone cancer does not have a clearly defined cause, although there are several factors that increase the likelihood of developing bone tumors. Often people develop primary bone cancer because they have been treated with radiation for other cancers. This is especially true for children. A few number of cases may be due to hereditary factors. Osteosarcoma happens most often in people ages 10 to 19. Chondrosarcoma usually occurs in people over 40 and increases with age. This type seldom occurs in younger people. ESFTs are most frequently found in people under 19, with boys being affected more than girls. Pain is the most common symptom and usually starts out being painful occasionally as the cancer grows and it becomes more constant. Swelling may occur in the area of the tumor, and sometimes it is possible to actually fill the tumor, depending on where it is located. Because bone cancer weakens the bones, people may discover that bone cancer when they go to the hospital with a broken bone. All cancers cause unintended weight loss and extreme tiredness. Bone cancer is no exception. There's also be numbness or tingling in the tumor if pressing on a nerve. Sometimes bone cancer can be diagnosed on the symptoms that are presented. However, to be certain, bone scans, CTs, or MRIs may be used. A final option would be to perform a biopsy. This is where the doctor removes a sample of tissue to be examined in the lab to determine if it is cancerous or not. They can either do this as a needle biopsy or a surgical biopsy. With surgery, determining whether they keep the limb or amputate the limb will depend on whether the tumor is and how big the tumor is. The majority of patients do not have to have an amputation. Chemotherapy is destroying the tumor with drugs. Usually they do chemotherapy on top of surgery and is often used if the cancer is spread or is very fast moving. Radiation is using X-rays to destroy cancer cells and is used when the tumor cannot be removed or before surgery to shrink the tumor. In conclusion, it is found that primary bone cancer is extremely rare but often occurs in children and younger adults. The survival rate, however, is fairly high and there are numerous treatment options for primary bone cancer. It is also found that cancer that has metastasized to the bone is a great deal more common and much more deadly. However, just because it is located in the bone, it is not truly bone cancer, and instead a bone metastasis named after the area that it originated from.